Dentistry's changed, and it's been a great thing. And I've gotten to be in some of the most exciting part of it, in my opinion. Again, I may be a little bit biased in that, but dentistry, the mechanics of a lot of dentistry has not changed, but the way that we do those things, the way that we deliver those to the patient, in my opinion, has changed dramatically. It's no longer this chair grabbing, gripping, sweat it out, and then create a horror story, and then a sedation patient for life. Granted, we do sedate a ton of patients basically because that was created back in the day, and now we just don't do that, which is why we are that much more intent on taking care of the kiddos in the right way so that we don't traumatize them like the rest of you 50, 60, 70, 80-year-old crybabies. And we don't view you as crybabies. We know something terrible happened to you, and that's why we cater to that. And that's why we sedate you. That's why we make you go to sleep, and you wake up and all your dentistry is done. And so that's one of the huge things that we can safely do. We do it all the time, and it's like anytime I'm trying to talk a patient into doing sedation, I just stop and I'm like, look, this is the way that you're gonna love. If you don't love it, you never have to do it again. But guess what? Everybody else says that's the way I want my dentistry done, because it is wonderful. We have changed the speed that we can do dentistry and do it excellently as well. We're able to make crowns with way more precision than what we could ever make. In the past, I used the best labs before, and now we're able to mill them with way more precision than what we ever had before. And they're fantastic. And I'm a control freak, and so is my team, and we really like having everything designed so that it's gonna last a lot longer than what we could find or buy anywhere else. Our imaging, we used to have to drive in the dark when we were using x-rays, 2D x-rays and stuff like that. Does it give us good information? Yes, but now we have 3D technology and we're able to do all sorts of stuff. We can do virtual surgery on somebody before we ever actually touch them. And so we know what implant size is, where the teeth are, how to get the roots out. It just makes it a whole lot easier for the patient to be able to recover, to be able to heal because of the different manipulations that we can do by seeing everything in 3D. It's like, I don't know, X-ray vision except in 3D. And the amount of radiation that we get from it, you know, people are like, oh, radiation. Well, yeah, it's something to be actually concerned about. You know what, if you'll just put down your cell phone for the day, you'll probably have less radiation than what you got exposed to in our 3D scanner. I really think that today's dentists, a lot of them that are coming out, are a lot more attuned to the patients that are there. I'm not trying to diss on the old guys. There's some great dentists out there. Newer dentists are truly embracing technology, and we're using it to our advantage and to the patient's advantage. Like, it's a big win for all of us in that, and we're not throwing out all the old. We're just building on top of it so much and so quickly that it really ends up benefiting the patient and us a whole lot better in the way that we're able to make lasting excellence in dentistry. So back in the day, the only real options that we had, they had some pretty primitive implants, and they had some options like that, but only the very wealthy could afford that, or doing single implants for every single tooth. And so by and large, the answer was dentures. And so you just hear, you know, I'm telling you, our forefathers, they were just tougher than us because they would gum stuff, and they didn't live as long because they couldn't get good nutrition either. So back in the day, we had dentures, and I'm not throwing them out. They are an acceptable mode of treatment. It's just that we have just a way better way of taking care of people with implant teeth all in the same day, almost every single time. And so that's a huge thing for us, and that's come along in my career and has just been really rewarding. We have evidence stuff, and we know that it works, and we know that we can do that for patients. And so another great thing that's happened in dentistry is that I'm seeing more general dentists becoming more versed at being able to do more things, which is great, because most people don't want to go from one office to another office. They want to know that, hey, I'm here, I'm home, I'm comfortable with this place, I'm comfortable with these people, and I don't get mixed up in getting lost between offices and who's doing what and what procedures happening here. So don't wait for your dental problems to get any worse. Come down, let's actually at least look and see what's happening. We don't actually have to do anything if you don't want to. but let's take a 3D scan, let's look and see what is actually in there. Sometimes the best thing you can do is open the closet and see how big the boogeyman really is, because he might not even be there and he might not be that intimidating. Give us a call.